Hi, welcome back to the channel. Today we are focusing on the key part of lab accuracy, that is quality control in serology. Whether it is your blood grouping, antibody screening or TTI testing, quality control ensures your results are reliable, reproducible and safe for the patient care. Let's get started. Quality assurance. So it's a sum of total of the organized arrangement with the objective to ensure that the product will be of a good quality that is required for the intended use. It will include your retrospective review, analysis of operational performance data to determine that the overall process is in a state of control and to detect the shift and trends that are required control. So testing routinely perform test activities on material or equipment to check their proper function. The monitoring system that check the effectiveness of the existing process step by testing the quality of the final product. What are the essential of the quality system? So these include your organization and leadership, facilities, work environment and the safety, human resources, customer focus, suppliers and the material management, equipment management, process management, documentations and the records, informative management, management of the non-conforming events, monitoring and assessment, and lastly the process improvement. There are two types of control, internal and the external control. The internal control can be maintained by going through a complete checklist of the item or test daily to make sure that all the systems are being monitored and are in control. So in this control, immediate decisions can be taken to accept or reject the run or the product. Whereas in the external quality control, it's a way to compare the performance of a lab with the reference to the other lab. External quality assurance, also known as the proficiency testing or the external quality control. Quality in the blood transfusion services. So in blood transfusion service, the primary goal of the quality is transfusion of the safe unit of the blood. The quality system deals with all aspects to ensure that the product or safe unit of a blood is safe as possible. What is the objective of quality in the blood bank? To ensure the availability of a sufficient supply of a blood component of high quality with maximum efficacy and the minimum risk to both donor and patients. To determine the problem in the whole transfusion chain and to solve it to achieve the goal. The quality management system in the blood bank. So in blood transfusion center, it means that a management system should be exist to look into the provision of a safe unit of blood and if any errors are identified, these should be corrected. What are the steps involved in the quality control of blood bank? So donor selection and the blood collection is the first step, followed by the lab serology, TTI testing, component preparation, then the cross matching and antibody screening. Then there should be a proper storage, issue and the transportation of the unit. Why there is a need for the quality? So a failure in the quality of the blood collected or screening of the donated blood unit can be very serious and may result in the fatal consequences like failure to identify the patient correctly, wrong label of the sample, mix up of the results among the different patient or failure to detect the presence of an abnormality in the patient sample, issue of the unscreened blood due to the clerical or technical errors. Foremost, we'll start with the quality control of the reagent. The primary objective of a reagent quality control is to ensure that the reagent is functioning as expected. This has the reagent requirements. Like all reagents should be clearly labeled with the batch number, expiry date, and the storage temperature. Instruction for use should be in the form of the SOP with training. All the reagent and kits should be used according to the manufacturer instruction. And FIFO shall be maintained, that is first in, first out. Use of positive and negative control should be done with each batch to show that the reagents are potent and the specific. All reagents must be carefully stored at recommended temperature. Reagents should be kept at 4 to 6 degrees Celsius, should never be frozen or stored according to the manufacturer instruction. Supply, storage and the transportation of the kits and reagents should be strictly standardized and manufacturer's instructions should be followed with ensured continuous power supply and periodic temperature monitoring. Log of the reagent. Reagent record should include the name of the each reagent with their lot number, batch number, expiry date, manufacturer name, and date of receipt and put in use. Grade and strength of reaction at each time of the receipt will be done. Now, frequency of the quality control of the reagent. For anti-human serum, blood grouping serum, antibody screening, and the reverse grouping cells, normal saline, bovine albumin, these should be done each day of the use. Whereas for enzyme, for every run you have to check the quality of that enzyme. Quality control of reagent red blood cells. So what are the parameters we will look? First we will see the appearance. There should be no hemolysis or turbidity in supernatant by visual inspection, and this to be done every day. Then reactivity and specificity. Positive reaction with each known antisera against the red blood antigens. That also to be done every day. Now QC of ABO reagents like anti-A, anti-B and anti-AB. This for the appearance we have to do it every day. There should be no turbidity, precipitate, particles or gel formation by visual inspection. Then for the specificity there should be a positive reaction with the red cell having corresponding antigen with no reaction with the negative control, that is also daily or with the every new lot or batch. Avidity macroscopic agglutination with 50% of red cell suspension in homologous serum or normal saline using the slide test. 10 seconds for anti-A, anti-B and anti-AB with A1 or B cells at room temperature, 20 seconds with A2 and A2B cells. Reactivity, no immune hemolysis, Role formation or prozone. Potency, undiluted serum should be present, like 3 plus reaction in saline tube test using 3% of red cell suspension at room temperature, and titer should be 356 for anti-A, anti-B and anti-AB with A1 cells, and for B cells 64 with A2 and A2B cells. Now anti-D or RH antisera, the quality accepted is the appearance, no turbidity, precipitation, particle and gel formation by visual inspection. For every day you have to check for it. Specificity, positive reaction with R1 R cells or known D positive cell. Avidity, visual agglutination with 40% red cell suspension in homologous serum using the slide test. Reactivity, no immune hemolysis, Role formation or prozone phenomena. Potency, undiluted serum gives 3 plus reaction in designated test for each serum and a titer of 32 to 64 for anti-D. Now accepted titer and avidity for ABO reagent. For anti-A, if you are using the polyclonal with the A1, it will give the titer of 256 and the time is 10 to 12 seconds and the intensity is 3 plus. For monoclonal, if you are going with the A2, then the titer is 1 is to 28, and for A to B it's 1 is to 64 and the time is 15 to 18 seconds with the intensity of 2 plus to 3 plus. With the O cells, that is 2% to 3% suspension, it will not show any kind of titration, avidity and intensity. With A1 cell, the monoclonal, it will show 1 is to 256. With A2 cell, it will show 1 is to 28. With A2B, 1 is to 64. With the A1 cell, the time is 3.3 to 4 seconds. With A2, 5 to 6. And with A2B, also 5 to 6. Then for the monoclonal anti-B, the B cell 256 is the titer, 10 to 12 second and 3 plus is the intensity, and A1B 128 is the titer, 12 to 15 is the avidity time and 2 plus is the intensity. With the monoclonal A1 cell, it won't show any reaction, and with the monoclonal B cell, again 256 is the titer, and with A1B 128 is the titer. With the avidity time for B cell is 3 to 4 seconds, for A1B is 5 to 6 seconds, with the intensity of 4 plus with the B cell, and A1B 3 plus will be the intensity. For anti-AABB, the polyclonal with A1 cell, the reaction will show the titer of 256. With B cells, again 256, and with A2 cell, 1 is to 64. with a time of 10 to 12 for A1 and B and 15 to 18 seconds for A2. The reaction of 3 plus for A1 and B cells and 8 for the A2, it will show 2 plus to 3 plus. For monoclonal A1 cells will show 256 titer, for B cell again 1 to 256 with a time of 3 to 4 seconds and the reaction of 4 plus. For A2 cell 128 will be the titer and 5 to 6 seconds will it take, and the intensity of the reaction is 3 plus. The acceptable quality of antiglobulin gel or bead reagent, the appearance is it won't show any precipitate particle gel formation by the visual inspection. There should be no chromosome phenomena, no hemolysis or agglutination or unsensitized red cell. Agglutination of the red cell sensitized with anti-D serum containing not more than 0.2 mg per ml antibody activity. With each day and every new lot or batch, we will see the reactivity, specificity, and the appearance. In serology, even a small mistake can lead to a serious consequences. That's why quality control is non-negotiable. Thank you for watching, and remember, accurate results start with strict quality control. If you found this helpful, don't forget to like, comment, and subscribe for more content.